Go Blue.
In today's Health Alert, October is Breast Cancer Awareness Month. The disease is so common that most people know someone who's been affected by it. That's why we brought in our chief health editor, Dr. Partha Nandi, to discuss the importance of screening and prevention. And Dr. Nandi, this doesn't just affect women, it's men as well. So what should we know about getting tested?
Yeah, breast cancer is an epidemic for me. When it comes to breast cancer, early detection is super important, Glenda, because when it's found early, guess what? The cancer is small, hasn't spread, so it's much easier to treat, and that boosts survival rates, right? So this year, more than 240,000 American women will be diagnosed with breast cancer. Unfortunately, about 42,000 will die. That's too many, in my opinion. As mentioned, the disease also affects men, right? That's because everyone is born with some amount of breast tissue. However, in men, breast cancer is not very common. About 1 out of every 100 breast cancers diagnosed in the U.S. are found in men. So what should folks know about getting screened? For women, mammograms are the best way to find breast cancer early. There's also breast magnetic resonance imaging, or MRI for short. However, this test is not used for women at average risk. For men, mammograms are typically not recommended unless they have genetic mutations or a family history of breast or ovarian cancer. And for both men and women, you should be familiar with how your breasts normally look and feel. If you notice any changes to the nipple, lumps, or pain in the breast or underarm area, talk to your doctor right away.
So what are the risk factors and how do we lower our risks?
Yeah, important question, right? So studies have shown, Glenda, that your risk for breast cancer is due to a combination of factors. However, key factors that increase your chance, and they include age, increasing age, as most cases happen after age 50. Also having dense breasts, as this makes it harder to detect cancer on mammograms. Also having a strong family history of breast cancer or inherited changes in what's called BRCA1 and BRCA2 genes. It's super important to mention that some women have zero risk factors. We know those folks outside of being female and still develop cancer. As for lowering your risk, here's some of my advice. Maintain a healthy weight, get regular exercise, and consider limiting alcohol consumption. If you're using hormone replacement therapy or birth control pills, please consult your doctor about potential risk and, if possible, breastfeed your babies. Lastly, when eligible, please, this is important, schedule your mammogram. The United States Preventative Services Task Force recommends that women aged 40 to 49 talk to their doctor about when to start, and women who are 50 to 74 years of age to get a mammogram every 2 years if they have an average risk for breast cancer. The key is that, I see so many women with breast cancer, but it's preventable, and if we treat it early, you can get rid of it and live a normal life. That's the key if we can get there.
Yeah, and if you have dense breasts, you have to have a special kind of test, maybe even that 3D.
Exactly. Talk to your doctor. There are many mechanisms, many testing mechanisms are out there, including even MRI.
All right, Doc, thank you.
Hey, my pleasure.
All right. And if you have a health question for the good doctor, you can email him, Dr. Nandi, at askdrnandi.com, or send it to us on Facebook or Twitter. We'll get it right to him.